Public Health England last year did a survey looking for how general practitioners, GP practices, support menopause women in the borough of Hammersmith and Fulham. What comes out from this survey comes out very clear, a completely system fragmentation. There are some very good areas of excellent care across the borough, but also there is a huge gap in coordination, particularly in reaching areas that need the care the most, areas of high diversity and high social economic issues. In other words, there is no wide borough standard of care. Good menopause care in Hammersmith and Fulham borough often relies on luck. Which postcode do you live in? Which GP practice are you registered in? Which GP are you seeing? This is not a woman's problem. This is a system problem. And it's important for me to say clearly here that doctors' care guidelines are being followed, and there are these excellent pockets of care across the borough. One strong example of a good care is the work currently being done in South Fulham PCN, Primary Care Network, where they created a women's health hub 3 years ago. This hub delivered a menopause clinic in the primate care, so near to the patient home, with minimal need of use for the second care. This model has already shown to be effective, cost-effective, because decrease hospital referrals, decrease secondary care referral, and has already proved to increase community trust because it delivers the right care in the right place at the right time. Working as a menopause specialist in the borough of Hammersmith and Fulham, based at Charing Cross Hospital, I was approached by Public Health beginning of this year, a couple of weeks ago. We are still sorting out solutions to collaborate with this matter. And my proposal is simple. Let's use what already has proved to work. Let's use the model of South Fulham PCN and scale to North Fulham PCN, where deprivation is higher and the care is often uneven. Although at the beginning it might sound costly because we need to invest in infrastructure and trained staff, it will be cost-effective in a long term because it will improve mental health, bone health, cardiological health. It will support women in the workplace. They will earn more. They will pay the tax. It will help families, workplace, and society in general. To conclude, I'm extremely keen on collaboration with public health because I believe it is possible to standardize, to scale, and to make menopause care more equitable in Hammersmith and Fulham borough. Moving from a fragmented care, good standard care, fragmented, to a more integrated, resilient care. We are ensuring ladies that they don't need to rely any longer on luck, but on fair, consistent, and sustainable system for every woman.